We are here, like every Tuesday, meeting yet another doctor who is doing things differently. In this COVID era, the pandemic era, we have realized the importance of these healthcare professionals in our lives. And every Tuesday, I bring to you somebody who has not just done the routine work that a doctor does, but have done something beyond that. Today, I have with me Dr. Vinayak Hingane, who is an MBBS from Indira Gandhi Government Medical College, Nagpur. He has done his DNB in internal medicine from Dinanath Mangeshkar Hospital, Pune. And he has had also experience in internal medicine from UK. So I'm very, very happy to introduce a very dear friend, Dr. Vinayak.
Thank you, Apar, and thanks a lot for such a kind and nice introduction. Uh, Frankly speaking, it feels, I really feel very honored when you talk like that. Uh, Especially nowadays when we are facing this pandemic and everyone is so panicked nowadays. People look at doctors with a very big hope, and with the pandemic going on, we are not able to stop the pandemic, and there is a lot of burden on doctors as well, the emotional burden. And whenever somebody is talking about doctors and how good they are doing, it really feels great. So thank you very much, Apar.
Yeah, and it's so nice that Vinayak, being a practitioner from the allopathic stream, is also practicing something that I do for my living. That is looking at the lifestyle of the people, and he has been translating some good research work that has happened in the West in India. We will be talking to Vinayak about what he is doing as we go along. Just to brief about the initiative, this particular initiative we have started in coordination with Prayas Amravati, Kalya Health, and Own Your Growth, which is a student-driven organization of students who are trying to become physicians of tomorrow. These are yoga naturopathy students from across India, and they are here to learn from a lot of different sources. So I bring generally the conventional medical practitioners, but they are also learning from their own uh, people. Every time they have a lot of webinars where they bring a lot of good people to talk about. Now, Dr. Vinayak,
Apar,
yes, yes.
before you start asking me some questions, I really appreciate your effort and whatever you are doing, especially bringing the mainstream doctors, the allopathy doctors, face to face with people who are practicing yoga, naturopathy, because I believe that we have to think across the borders as well, because knowledge is universal, and whenever we can talk and share with other people, it really enriches us. And what you are doing is really wonderful. So congratulations to you.
Thank you. It's the team that is in the background. Own Your Growth is a big team of students who is doing things in the background. Uh, we will come to what you do in just a while, but before that, just wanted to know your journey in medicine. How was it to going to a medical college? How difficult or easy was it? What kind of preparation did you require to go there? Because we keep hearing that it is difficult to get admission to a government medical college. So how easy or difficult was that?
So yeah, I was probably the second batch when they had this they used to call it PMT, pre-medical test, and the entrance exam. And it was pretty tough, but I was lucky enough to, get into a government medical college in the first go. So for me, it was not too difficult, but yeah, it was a difficult task at that time. For me, the biggest hurdle was to get adjusted to the uh, new city life, because I was from a small town, and we used to only read English in textbooks. Apart from that, we never used to talk English. And it was a different environment for me. So yeah, I had not gone out of my town very frequently. It was the first time I left my parents and went there. So it all sounds very cliche, but it was a little bit tough for me at the moment. And the academics was not that difficult, I must say, but all these other things were quite scary at the beginning. But later on, I found out that there are people like me. Uh, I found really great friends, and after that, after like meeting my friends, it was like a pleasurable experience in the medical college.
I absolutely resonate your feelings because I remember I come from a very small town, and when I joined the college again, I had to struggle initially to learn English. Speaking was a big problem, but I'm sure a lot of the friends who are uh, watching this show now do not share that kind of a problem because a lot of them are used to English now. It is more, it has reached, penetrated a lot of towns, but
Yes.
also there would be some people who would definitely resonate our feelings.
I think
So,
even
yeah,
like even the English is like a different ball game altogether. But Hindi was difficult for me as well, because in our town we used to talk Marathi, and in Nagpur many people they speak Hindi, and we had a lot of people from rest of Maharashtra, and most of them will converse in Hindi, and my Hindi was. Like a movie like Bambaiya Hindi, and I used to use terms like "thandi baj rahi hai," and all my friends used to say, "हमको तो सुनाई नहीं दे रही है." So it was a big, like, so language is like, yeah, it was a fun time.
yeah, I think looking back at those memories is really something nostalgic. So, so once you have completed your MBBS from the IGGMC, how was it later on? What did you do? How did you proceed further?
Actually, for me, the journey started a little differently than my friends, because at that point of time, again, we had post graduate medical entrance exam. So initially, they used to just allocate the seats depending on the marks you have scored in the exam. People used to start studying for the exam, but I had and they had to break government for 1 year, and if you're not doing that, you had to break the bond. You have to submit that money. Unfortunately, I was not able to do that, and there was some financial problems, and I thought I will just go ahead with the medical duties. And I joined as medical officer in my hometown Buldana. It is a small district hospital, and I used to work there. It was a very different experience, because I had just passed out from my MBBS, and I had done internship. But apart from my internship, I did not have any medical experience. It was difficult, because when you are sitting in that chair of medical officer, you have to, cater every patient. So there were patients with snake bites, poisoning, myocardial infarction, all the emergencies you can imagine. And I had very limited experience, but at the same time, I had a good support. You might have heard about Dr. Himmatrao Bavaskar. He is a very,
He's a
enthusiastic.
world-renowned
Yeah,
forensic medicine and toxicologist, actually.
yeah. He's a great physician, and he did a lot of research on scorpion sting and snake bite. And luckily, he visits Buldhana pretty frequently. So I had privilege to meet him, and then he would actually guide me on phone about management of snake bite. He would encourage me about reading research articles, journal articles, and everything.
Mhm.
So he was a very good, you can say, online teacher to me. At that point of time, there was no concept of online teaching or phone consultations or anything. But he was really ahead of time. He would just tell me what to look for in a patient, how to identify the red flags and all those things. So it made my life a little bit easy, and but more exciting. And I would just I was on my toes all the time. I would read about snake bite. I would read about all the emergencies from the journals, and as you know, that all these topics are not covered in textbook very well. And you can land up with any complication of a given emergency. So basically, if you are reading from journals and different guidelines, so it makes your life a little bit easier. You know what to do about those things. So though I did not have much experience, I had the backing, and also the senior doctors from that hospital. They also helped me a lot. Being a younger colleague, they helped me a lot, and they guided me through those hard times. But reading Dr. Bavaskar, reading all those guidelines, journals, and things kind of kindled some interest in me about internal medicine. And it kind of emphasized the importance of research as well. So I got really interested into these things, and I thought, okay, probably I should follow my career in internal medicine, and probably get into some research as well. So that was my that is how my journey started about
So
internal
one of the
medicine.
key messages that our viewers should take is not just rely on the textbooks, but rather read things firsthand from journals where they can get the latest information, because that information from the journals to be translated to books can take years.
Yeah, that is true. That is true about some of the topics, and also I would like to, tell if there are youngers in our audience that we should also read about the guidelines. So uh, this medical knowledge is, as we know, that there are different levels of evidences. So textbook is very solid, like whenever the things come into textbook, they are like tried and tested. But at the same time, there are good amount of research going on in different fields which we are not aware of. So reading journals, reading guidelines, that helps a lot.
Okay, and how did you, I mean, how was the transition from internal medicine at Pune? How was your journey? Because Dinanath Mangeshkar became very famous because of the yoga intervention that they did during COVID. They had this Jalaneti and other things. And from there to UK, how was the journey?
Yes, so basically after my stint in government job as a medical officer, I studied internal medicine, and that was a really, enriching experience. uh, I felt that I need something more. And my wife, Dr. Renuka, she is also very studious, and like she wanted to explore some more things, and she got an opportunity to work in UK in NHS. So uh, that is their public health system. So she got an opportunity to work in NHS, and I thought it is a great opportunity for me as well, because if I get some experience of West, that can further enhance my experience, enrich my knowledge. So we decided to go to UK, and yeah, it was a great experience there as well, because though the medical part is not very different, because humans are basically same everywhere. So we get similar illnesses, similar treatments, similar patient interactions, but they have got a very different and unique health system, that their system is totally free. If you go to hospital, you don't have to pay anything. Even their ambulances, they don't charge, and it's a totally different system. And it was a privilege to experience that as well. So
Okay.
obviously we also got to like learn some of the practices, patient safety, and lot many things, how to interact with patients and everything. So the UK has a lot to offer to a doctor in terms of learning.
Oh, wonderful. But then now I think I'll come to the point where you are doing something exceptional. For my viewers, the name of the clinic that Dr. Vinayak is running is Diabetes Reversal Clinic. Uh, how, from being a medical officer in a government sector to internal medicine to going and practicing in UK, how did you come back and start this diabetes reversal clinic? What was the intention? What was the motivation behind doing that?
Yeah, it is a whole different story again, because and it is like it involves my personal experience as well. So while I was telling you my story about being in my internship, being in my uh, residency, learning internal medicine, that phase was exciting, but at the same time it was a strenuous phase. And I had to, like there was a lot of stress. I was not paying attention to my diet, and I was not exercising the way I should. I was trying, but I wasn't doing justice. And gradually I realized that my weight is like going up pretty fast. And by the time I like finished my residency and started working, I had gained around like 15 kgs or so. So it was a lot of weight gain in small amount of time. And being a physician, I was always like, it was at the back of my mind that this thing is not good for me. I'm getting overweight. I need to cut down on my diet. I need to exercise more. And, whatever the general instructions are given to us, I was trying to follow those. But I wasn't able to lose any weight. And when I came back to India, I for some amount of time I came back to India, and I checked my HbA1c, and it was 5.7 or 5.8, something like that. So I was inching towards pre-diabetes, and my father is diabetic, so I got really scared, and I was like, okay, this is the time I need to do something about it very seriously. Otherwise, I would land up in diabetic state, and then I will have to start medicines. And that was like this in really young age. I really did not want that. So then I took it very seriously. And again, as I told you, the studying journals and going through all the research material, that helped me a lot. I was just going, I was just going after the material. I was reading of what is there out about obesity, what is there out about, like all these insulin resistance and all those things. And what I realized at that point of time is that there is a lot of behavioral component behind my obesity, my or being overweight. So I need to change my behavior as well. So I started studying the association of behavior and diet and obesity and all those kind of things. And then I realized that, okay, this is what I need to do. And I started working on my health. And while researching this material, I came across a very interesting research by Dr. Roy Taylor in UK. So Dr. Roy Taylor is a person who works in Newcastle, UK, and he was doing studies on diabetic people. So his research was very interesting. He would basically scan these people, show that these people have got belly full of fat. Their liver and their pancreas, they were all full of fat. And what his hypothesis was, if you um, make these people lose their weight drastically and fast, then this fat disappears. And when this fat disappears, their insulin sensitivity comes back. And these people can stay free from medicines. So their diabetes basically goes into remission. That is what he found out. And the why I started reading this research was these people maintained their weight loss. So my main focus was weight loss because I was losing weight, and like I was trying to lose weight and I was studying about that. So I admired his strategy, that rapid weight loss, and then there are some uh, like steps to maintain that weight loss. So I was initially focused on that, but what struck me was this is something groundbreaking, that he showed with his research that the diabetes can go into remission. And even the phase 1 insulin response, which is lost in diabetics, that can also come back. So it was the first time that he showed that insulin response comes back in diabetic patient. That means the disease process of diabetes can be reversed. So that was really interesting. And
This is
I
very,
made
very interesting because I think we have always heard, ever since we have learned in our medical schools, that once you are a diabetic, you are a diabetic for lifelong and you just need to manage it.
yeah.
But
So
diabetes reversal by Roy Taylor is something
yeah,
groundbreaking.
so that was actually groundbreaking, and I was surprised, but that I did not know about it. So I was like, the way you are saying that, I was also like believer that, okay, once you are diabetic, you are always a diabetic. And then I realized, okay, this can be reversed. So this is something exciting. And like that was the moment I was like, wow, this is something really good. This is worth, like investigating. And then I started investigating that aspect as well. So by the time I had lost a significant amount of weight, I have started feeling really great. And my symptoms of insulin resistance, like you sometimes feel, some people feel always hungry. We feel hungry sometimes, but some people always feel that they are hungry. And these people are, they cannot skip even a meal, or they cannot even delay their meal. They get very anxious, they start sweating, they get cloudy in their mind. So, and some people, they feel that they should eat always. So that these are the early symptoms of insulin resistance as well. So I had developed those symptoms, and I got rid of those when I lost a significant amount of weight. So I thought, okay, probably what he's saying would be, like applied to everyone. And that point of time, they had not published the direct trial. So direct trial is a big trial which is a randomized control trial. And as you know, that in research methodology, we value these trials very high, because the level of evidence we get is quality, and these are very good scientific tools. So they published the randomized control trial in December 2017, I guess.
Yes, it
And
was
at
in
that point of
Lancet.
time, yeah, in Lancet, they published that study, and that was a really happy moment for me, because uh, that time that study was conducted in clinical settings, like uh, they selected few clinics in, or OPDs, like we call them OPDs or clinics in India. So they have they are doctors' offices, and they opened those doctors' clinics for patients, and they treated those patients in those clinics without any big scientific equipment. They just used behavioral modification. They just gave them counseling session. They taught them exercise. They taught them how to eat and everything. And only thing is that what they used was a small liquid meal. So it was just kind of a juice. The patients used to have one in the morning, one in the evening. These are simple, like balanced meal juices. And because of like in trials, we have to measure what they are eating. So to make that easy, they gave them these juice bottles. So that was the only intervention they had. So they gave them some diet, they gave them exercise and lifestyle modification, and they followed them in clinic. And that was a very successful trial. So can you believe that 50% of people who participated in that trial, they were free from diabetes and diabetic medication at the end of the year? So
When you say they were free from diabetes, I just want to clarify what exactly do you mean? Is
so
it their blood sugar levels coming to normalcy or something else?
yeah, so there was something that their blood sugar level came to normal, that is less than 6.5 HbA1c. All of the patients of diabetes, they know what is HbA1c. People who don't know, I can explain that this is your hemoglobin, which is uh, attached to glucose. So the glucose get attached to hemoglobin, and we call it glycosylated hemoglobin. So that shows how was your sugar control in last 3 to 6 months, especially last 3 months. And these last 3 months, if the patient's blood sugar levels are in control, their HbA1c should be less than 6. In non-diabetic, and in diabetic patient, if their control is good, it should be less than 6.5. So if if without any medication or without anything, if your diabetes HbA1c is less than 6.5, we call it non-diabetic, and more than 6.5, it is called diabetic. So all these patients, their HbA1c level were less than 6.5, who were in remission. And uh, apart from that, these people had great quality of life as well. And as I told you, they did not have any diabetic medication. So 50% people had no medication for the diabetes, and they did not have high sugar levels. So their sugar levels were normal without medication, and that we can call free from diabetes.
Oh, wonderful. So definitely diabetes reversal is possible is what Dr. Roy Taylor and his team demonstrated us through the direct trial. Now the question is, okay, this was in UK. Probably people are more aware. They can do it there. How is your experience to replicate the same in India? You came back to India and started your clinic here. How
Yeah.
is your experience
So
with it?
So Roy Taylor basically influenced me a lot, and I should also mention about Dr. Michael Mosley. If you watch BBC, then you might have seen the show Trust Me, I Am a Doctor. And the Michael Mosley is a presenter on that show. He is a medical doctor, and he went into medical journalism basically.
Mhm.
He brings out difficult research to lay people. So he is a very good presenter, and he actually took it on himself to promote Dr. Roy Taylor's research as well. So, and he kind of made a diet which is called as 800 calorie diet. So, Dr. Roy Taylor used 800 calories in his research. Dr. Michael Mosley brought out normal food in that 800 format. And Dr. Michael Mosley was also working on different diets like 5 is to 2 diet, and he's a big promoter of weight loss. So I was fortunate enough to meet him as well, and his literature and his thoughts also helped me to take this research out to public. So, uh, and the story started with my dad, because my dad is also diabetic, as I mentioned that earlier. So what we thought is we should basically try this thing out on my dad. I explained him that there is a research where people got rid of their medication. So he was very excited to learn about it. And then it was like my treat for him. And I asked him whether he could do regular exercise, he could follow to my instruction and everything. And he was like, okay, I will do whatever you say. And then we started him on a routine exercise regime. I asked him to sleep better, and we started him on a low calorie diet. And we stopped his medication. And to our surprise, within 15 days, his sugar level were back to normal.
Wow.
And then gradually we realized that, okay, he doesn't need any medication. Gradually he kept losing his weight. All his friends were very worried that why are you losing so much of weight and everything. And he kept losing weight. So to my surprise, he got really very skinny. And at one point I was also scared, like, why is he losing so much weight? But then he told me that he was always a skinny person in his young age. So after his marriage and everything, he had put on a lot of weight. So by the time I could remember him, he was a very he was a chubby person. But initially he was very thin and lean. And he said, like, when he joined his job, his weight was around 49 kgs, something like that. So he came back to his nearly came back to his original weight, and he got rid of his diabetes. So we did not have to give him any medication, and his HbA1c remains normal. He is free from any symptoms. And the good thing was he had lot of stamina after losing that weight. So he started feeling very enthusiastic. He started exercising on his own. Initially we had to bug him for it. We have to keep asking him to go for a walk, to exercise. But nowadays he does it on his own. And interestingly, he had asthma, and his asthma also reduced a lot in his in the intensity. So he doesn't need his inhaler much often. And his episodes are less severe and less frequent now. So yeah, is in total it was a win-win situation for me. And this gave me a real boost that, okay, we can basically, if we can do it with my father at home, then in India we can basically do it for people as well. And this is before I came back to India. I was still in UK, and we were my dad was successfully treated for diabetes reversal.
So you have somebody who has reversed their diabetes at home, and that probably would be a big confidence booster for you.
Yes,
But
definitely.
on the other side of it, Vinayak, very interestingly, the kind of measures that you're talking about, dietary modifications, calorie restriction, exercise, the lifestyle intervention or behavioral modification is all a part of the stream of practice that I practice, and a lot of my students and fellow mates practice. Yoga and naturopathy, we take pride in saying we are lifestyle physicians, but probably we are also not taught in our colleges that diabetes can be reversed. And this is a very, very interesting case study that you are telling us, that can be replicated, and it could be a big moral booster that, we would be able to do this for a very large number of people.
Yes, and the thing is that once people know about it, they come forward and they ask you to help you out with that thing. Because after my dad stopped his medication and he was happy and he was telling everyone, and people saw him running and doing all the exercise. People, his friends, my relatives, they started contacting me that like we are diabetic and we want to like at least reduce some medication out of it. We want to get healthier like your dad, and is it possible? And then it started in my family. My cousin, my uncle, they got their diabetes into remission. And then I came to India, and then I started this clinic with the sort like the big purpose of helping out the people with their lifestyle. And I named it as Diabetes Reversal Clinic because people are not still aware about this research. They are not aware about these things. Just I want to remind you that I'm not the only person doing this. There are a few more people who are doing it, but still the numbers are like very less, and people are not aware about it. Unfortunately, in India, there are a lot of people who claim, the wild things like we can cure your diabetes, we can cure your cancer, we can cure anything, and that is sometimes just like a bogus thing, and people are very much afraid of such kind of things. So whenever I talk about diabetes reversal, they some people feel that okay, he's just like telling things, but people who actually listen to me, who go through the research themselves, they realize that okay, this is something which is happening throughout the world now, but unfortunately it is not popular in India.
Yeah, I think this is something that I had experienced with my father getting in lifestyle medicine for heart diseases when he started way back in 2000. The Dean Ornish study, which is again a groundbreaking study in reversal of heart disease, has happened in 1980s. But again, people are not really looking at that, not doing what is being suggested. So again, now I think the way we got connected, myself with Dr. Vinayak, was through my father. When my father started activities of diabetes reversal, and that is where we were connected. So there are people who are doing it, and during the lockdown, we have been doing these batches of diabetes reversal together. Myself, Dr. Vinayak, Dr. Venugopal, along with my father and Dr. Jeevanlal Gandhi, who is a very senior naturopathy, Ayurveda, and allopathy practitioner. Uh, could you tell us more about this diabetes reversal program? I mean, it would be nice if you share it rather than I talking about it.
Yeah, so basically, when I do it in person. People come to meet me. But during COVID, it was a difficult challenge for every health professional to, provide services to people, especially diabetic people, overweight people. They are at higher risk of COVID morbidity and mortality. So, Dr. Sauji sir was very keen on trying this online program for people, and we started with one batch, and now we are into what, seventh batch, sixth batch.
Sixth
So we
batch is ongoing, seventh batch is announced.
yeah, so we have announced the seventh batch now. So people gather online. We teach them about diabetes reversal, and we teach them about how to change, we change their lifestyle. We advocate them medication changes as well, because whenever you are doing anything, any diet, exercise, lifestyle modification, it affects your sugar levels, and basically we have to uh, uh, um, avoid hypoglycemias in these patients, so we are taking care of that as well. So yeah, it was a just a small experiment, but which is growing rapidly, and people are doing really well in those studies, like uh, in those batches. I think in first few batches we got around 80% of people were able to like reduce their medication doses. They lost weight. Some of them lost around 10 to 20 10 to 12 kilograms of their weight, and their sugar levels got it under control, and it was a great experience for participants as well as for us doctors.
Yeah, definitely. So I think I have a couple of questions for you, which are very, very important for any healthcare professional who
Sure.
is trying to do something new. Basically, when I had to explain that I am in yoga and naturopathy and there is a medical program into it, people would ask, what do you do? So I think when you start talking of diabetes reversal as the name of your clinic, people would, I'm sure your friends would also ask you, what exactly do you do? So I would like to know, when a patient approaches you for, I'm sure not just diabetes, but you work as a consultant physician, you treat everything. So what is your approach to the patients and what do you suggest them?
Yeah. So basically, it was I had to spend a lot of time before I came up with the idea that how I'm going to actually do it. And the way I do it is the patient walks in, and consults me about his diabetes. So I just go through his history. I just get a picture of his lifestyle as well, because I have a like questionnaire where I ask them about their lifestyle, their exercise, diet in detail, their sleep, their sleep patterns, and all these things, their stress levels, their occupation, and everything. So I have that questionnaire. I get their medical history, and then I get a picture of that person's lifestyle as well as their disease condition. And depending on that, I first consult him about his medication, and then I gave them a lifestyle plan. So I believe that there is no single diet which can help everyone. So obviously there are principles which are universal principles, like calorie reduction, reduction in the carbohydrate levels, reduction in the processed food, reduction in the fat. All these are the principles, and then everyone has got unique food preferences. So I try to figure that thing out, and then I give them a diet plan. I give them exercise plan, because not everyone can exercise the same. So I try to take their things into consideration, and then I try to uh, give them these plans, and then I counsel them for sleep as well. And once I give them this, I have some counseling sessions where I invite these people and I teach them about diet, the principles which they are going to follow, and why we are like following these things and not that thing. And I also teach them about exercise. I teach them about sleep. So I got kind of 3 sessions for them, and they can come and join this session again and again if they have like doubts. And these are interactive sessions. So uh, you- I'm, I talk to them. I entertain their questions, and that gives them a lot of confidence, because as I told you earlier, there is a behavioral component to it as well. So if you know everything about diet, if you know about everything about exercise, you cannot do it, because you need, like, some stimulus, you need some motivation as well. And we need somebody to, like, monitor our progress. So that is my role. So I uh, help these people, and every week I plan these counseling sessions. So every week person comes and meets me, he learns about new things, and then they can get their queries solved as well, and they can see their progress, they can discuss their progress as well. So that is how I conduct this program. And mm, to my surprise, not exactly to surprise, but people really liked it. And
I
a
think
lot of people were.
something that the word doctor is usually related to drugs, but the word doctor comes from doctrine, which is education, and I think you're hitting the bullseye when you are saying, you take a lot of counseling sessions and take time to talk to your patients and explain them what exactly do they need to do.
Yes, and I think that is very important, because what I am trying to achieve cannot be done without these things. And if you look at direct trial, a lot of people discuss about direct trial nowadays, but very few people I have seen discussing about the role of the sessions they had. They had got intensive lifestyle modification sessions. They invited people there, and uh, they made them, like, learn about their lifestyle. They motivated them, and they solved their problems. So that is what I realized that. And that was my personal experience as well. I knew a lot of things about diet and exercise, but until and unless I was, like, motivated enough, I did not do anything. So we need to fulfill that as well when you are talking about diabetes reversal.
Thank you. Thank you so much for that, Vinayak. We have a couple of questions coming from the participants. We have people joining in on Zoom, about 90 of them, and also about 40 people are there on YouTube chatting
Yes,
with
thank
us
you so much.
concurrently. So one of the things is, if somebody is newly diagnosed with diabetes and they have started with medications, what is your strategy to how do you cut down on medications, or and do you get any withdrawals when you're cutting down on medications or something like that? What is the kind of approach that you have towards these kind of patients?
Yeah, so very interesting question, and a lot of people have doubts about it, and a lot of doctors have doubts about it as well. So what they did in direct trial was very interesting. They did was they stopped their medication. Obviously, the people who were not on insulin were enrolled in the direct trial. So what they did was they stopped their medication, and they started them on very low calorie diet, and then they followed this patient down. So whenever you stop the medication, what happens is that you don't have risk of hypoglycemia, that is low blood sugar level. So when you stop those medication, and then you follow these people, you don't have risk of hypoglycemia. At the same time, you are giving them very low calorie diet. 800 calories in a day is a low diet. So most of these patients do not get very high sugar levels. So that is the strategy used by direct trial. But in our practice, we cannot always go ahead with this kind of practice, because people, we have to assess that whether these people are eligible for diabetes reversal, or they are high risk of trying these kind of things. So some people, they have very high level of, like, high doses of medication, and they, some of them are on insulin as well. So these people are not very good candidate for diabetes reversal like they did in direct trial. So we have to find out how much their body is coping up with medication, how much their body is making insulin. We have to get some idea of that, and then we have to gradually adjust their diet and we have to adjust their medication as well. So interestingly, as we are talking about it, uh, in 2020, uh, the American Diabetes Association had released their guidelines on diabetes as well. So in those guidelines, they have included diabetes reversal, and these studies, they have mentioned these studies, direct and other studies, and they have proposed something like very low calorie diet, high intensity lifestyle modifications. They have included these things in their guidelines as well. So their guidelines talk about different types of drugs. Like there are medications which reduce the insulin, uh, which uh, which help you to reduce the weight. Some medication increase the weight. So weight neutral medication, weight increasing medication, weight loss medications. So all these diabetic medication, they have effect on your weight as well. So they have categorized those medication according to that, and we can choose different medication in these patients depending on our experience and expertise in these types of medication. So basically, again, it is a tailor-made thing. We have to assess individual patient and get their things
So
done.
you are not going to give 800 kilocalories of diet to everybody. Rather, you will
Definitely
be
not.
assessing them and then prescribing.
So if ideal candidate comes to me, then probably we can go ahead with that kind of approach, and that helps a lot. But not in everyone. And I must say this is not something which can be done uh, without experience. So you have to consult your physician, you have to consult your doctor, and uh, get the things right. So if a person who is, you know, like diabetic for ages and he is on all these medications, suddenly decide to stop his all the medication and, you know, like go for low calorie diet, there are chances that he might land up in complications. So we have to look at all these things and go ahead according to that.
Okay. The other question that has come up with respect to diet is uh, people are now talking of how millets can be useful, how specific foods or superfoods can be useful for diet,
Yes.
diabetes and all other health problems. In fact, there are practitioners who would say that you take millets for 6 months and everything will be cured. What is your take on it?
Yes, so basically, nothing is like there is nothing called as superfood. Let me clear you on that. Uh, this is my point of view, but I don't believe in superfoods. The thing is that uh, transitioning from one carbohydrate to another might not help you at all. So if you are eating wheat and you just transition to millet, the same quantity of millet, probably it might not help you in weight loss or in controlling your diabetes, because again, there are some variation, but at the end of the day, they are carbohydrates. They are going to give you glucose load, and their glycemic load is not very different. Their glycemic index is not very different, and especially when you are using processed carbs. So we are not eating wheat or millet as, like, you know, whole grains. We are grinding them. We are, you know, like filtering them out. We are adding things to them, and then we are making things out of them. So it is increases their glycemic index. So if you use one carbohydrate instead of other, it doesn't help you that much, but reducing the quantity definitely helps you.
Okay, one question that I would personally love to ask, and this is something that I keep getting every time questioned whenever I'm consulting a diabetic. Can a diabetic eat fruits?
Yes. So the thing is that there is a lot of, you know, like lot of people tell that, okay, don't eat fruits. And diabetic patients stop eating fruits, their blood sugar level gradually goes up despite not eating fruits, and their health keep on deteriorating. They don't achieve anything by not eating fruits. The only problem in India is that our meal is very carbohydrate rich meal. And in every meal, we eat around 80% of carbohydrates. Like, the calories or the portion wise, 80% of our meal is usually carbohydrate, and that results into the glucose load. So people who cannot tolerate this glucose load, basically they are diabetic, and these people get spikes in their blood sugar level, and we try to manage those spikes with medication. But when you eat fruits, not all of the fruit is glucose. Some of it is glucose, some of it is like natural fructose, and lot of it is fiber. And the glycemic index of many fruits is not very high, and the glycemic load is also not very high. So if we look at it very closely, and if we manage our calorie count and like our portions very well, we can eat fruits even in conventional treatment of diabetes. And when you are like cutting down your calories, there is always a scope that you can eat some fruits. These fruits will give you vitamins, minerals like potassium. They can give you like colorful chemicals, phytochemicals, and these chemicals are useful for different body functions. Say for example, color vision, night vision. So these are benefited from eating fruits and vegetables. So fruits and vegetables are a must and very important part of our diet, and everyone should basically include those things in their diet. So you can basically talk to your doctor that, okay, I need to eat some fruits, and can you please help me out figuring it out, how can I include it in my diet? Or you can meet a dietitian, but definitely you can eat fruits. You
I
should eat.
think you're just clarifying the point that all naturopathy practitioners have been talking, that fruits are not harmful for a diabetic. Of course, you will have to tailor make your program based on your health issues, but it is not a single rule that you are a diabetic, so fruits are absolutely
Aparna,
not for you.
let me tell you one thing. I have got a very interesting story that one person went to a doctor who is a modern medicine doctor.
Hmm.
He asked him, "Can I eat fruits?" And that doctor told him, "Okay, you can eat fruits, not a problem." And that person came back to the doctor and told him that, "Okay, doctor, I have started eating fruits and my sugar level have shot up." And then doctor asked him, "Okay, what kind of fruit are you eating?" So he told them that, "I'm eating sitafal." "Okay, how much are you eating?" So he said, like 4 or 5 in the morning and 4 or 5 in the evening. This is the sitafal season and I'm eating those. So basically, if you are eating half a kilogram of any food at one point of time, your sugar levels are going to go up, isn't it? So yeah, so that is the funny part of it, that some patients, they don't get it. But even the modern medicine doctor I have met, they do not restrict the fruits and vegetables in the diet. And if we have some time, I can share you one interesting photo. Like,
Sure.
so it is about, like, as we were talking about the modern medicine. uh, so this is, let me,
Yeah, I think
so
we
this
have
is
your
this is a
screen now.
screenshot from my textbook. Okay, so this is a textbook thing. It is not a new research or anything. So in textbook of medicine Harrison's, uh, the type management of type 2 diabetes, if you can see, it is first is glycemic control. The first thing is diet and lifestyle, exercise, and then medication. So for type 2 diabetes, even the textbook of modern medicine, they put an emphasis on diet and lifestyle. And if you look at, so these are the most important thing, and not only diabetes, about hypertension as well, and also about heart disease. So diet, exercise, lifestyle modification, weight loss, they have paramount importance. The only thing is that we fail to change the behavior of the patient. There, that could be the like lack of time spent by physician, or there's lack of patient awareness. Then this is another screenshot, and this shows the reversibility of type 2 diabetes. So this is again the textbook, and this is not a recent, this is last edition of the textbook. So basically we always knew that diabetes can be reversed. So if you look into this diagram, this is a type 1 diabetes. Type 1 diabetes, there is a one directional arrow, so it cannot be reversed. But the type 2 diabetes and the gestational diabetes, that can be reversed. So you can see that there is a bidirectional arrow to it. So we always knew that diabetes could be reversed. The only problem was we did not know how to do it in clinical setting, and how to like get it done. And the direct trial has actually helped us with that. And he's Roy Taylor, and if you can look at this image, this is an MRI scan of the liver. So this is 36% of liver fat in a diabetic person, and after going through a low calorie diet and weight loss, you can see that this green fat is disappeared from the liver. So liver and pancreatic fat is a main problem for type 2 diabetes. And if you lose weight rapidly, this fat goes away. And when this fat goes away, then we can reverse the diabetes. And this is how they did it. First, they did a counterpoint study where they showed that insulin resistance and beta cell dysfunction can be reversed by losing weight and reducing the fat from those organs. So they did MRI scans, and they showed that if you are able to clear the pancreas and liver of fat, and then your insulin sensitivity improves. So that is what they showed in counterpoint study. And then in counterbalance study, they showed that this can be sustained. It is not the fasting state. Like a lot of people have doubts about this. Like, that once, you fast for a few days, your HbA1c will go down, or, like your insulin resistance will go down for some time. But they showed in the other study that it can be sustained even if you are eating normal calorie diet. So it is not like patient have to eat 800 calorie for his lifelong. They just use that 800 calorie diet for some time, and after that they transition those patients to normal isocalorie diet. And then that this patient on normal calorie diet also maintain the normal insulin, the normal glucose response to normal glucose levels. And they did it in a big trial, which is a randomized control trial, and that trial was direct. So this is kind of a like evolution of diabetes reversal. So now we know how to do it, but we always knew it from the beginning. And you mentioned it very well that the naturopathy people, they put a lot of emphasis on the diet and exercise and lifestyle. But the thing is that it is hardly ever taught how to do it, and the emphasis is not there, unfortunately. So if we put a lot of effort into it, I think we can basically change the world. We can reduce the diabetic numbers.
Wonderful, wonderful to hear that, Dr. Vinayak. Just very quickly, I think there are very enthusiastic participants who are questioning continuously about food and different aspects of it. But I think we will just pause that and move on a little further. I wanted to know about you as a person. What are your hobbies, and how I know for sure, I mean, I've known you for a while, but just for our viewers, Dr. Vinayak is a good writer. He writes blogs extensively. He has his own YouTube channel wherein he puts in a lot of health related videos. He invites a lot of experts, just the way we are having an interaction today. He keeps interacting with a lot of experts from different areas. He also is a painter. So, Dr. Vinayak, how these hobbies help you as a person as well as a professional?
So Yeah, it's a very interesting question because hobby is just a hobby basically. I used to, paint when I was in school. I used to like painting, and I tried to, keep that hobby with me for a long time. And luckily, from time to time, I could spend and invest some time into it. So it was just a hobby to start with, basically, and but I realized that when I was, like going through tough times, whenever I was very stressed out, these hobbies actually helped me a lot. So, as you know, that our stress levels, stress hormones, they play a very important role in our health. And hobbies and sports, these are the two things which basically keep us away from that, deadly stress. Uh, I think rather than saying keep away from the stress, they kind of enable us to cope up with the stress, because
Absolutely.
lot of us have stress, and the stress is non avoidable. But these hobbies help you to keep, like cope up with that stress, and it helped me from time to time. And if you're asking about writing, I had developed liking for medical writing, that since last 5 or 6 years I'm writing blogs and articles for health education. Initially I thought, it is just futile, because nowadays there is internet and everyone can, go and google it and read it. But I realized that there is lack of content, uh, and a lack of content, especially in Marathi, which is my mother tongue. People do not have enough of quality material. So I kept on writing, and yeah, it's getting a good response, and it is helping me to stay connected with the patients, especially in COVID times. I can write articles, I can, put out information there, and people read it, because that even in COVID times there is a lot of misinformation, there are a lot of rumors, and people feel confused. So it helps them as well. So that is that is my another hobby turned into, like professional tool. I published one book a couple of years ago about obesity and my experience with it, and that is also helping out people. So people who cannot attend my, sessions, or it is very difficult for them, they always read my book. And my blog and YouTube channel is also out there to help people with these kind of things. So that is my interest for last few years. It kind of give me a pleasure, as well as a pleasure of writing, as well as it is a professional tool for me nowadays. So I can show you that I have one. This was something about ADA guidelines, and what they are mentioning. This is something I came up with when I was thinking about obesity and effect of obesity on our health. And this is my this is the back of my files picture. And this picture I use for patient education, that how their exercise, lack of exercise, how their diet, how their, sedentary lifestyle, how their stress is affecting their health, and how they are getting obese, and like all these illnesses are related to obesity very closely. So this is one of the, like, hobby thing which came very handy to me, and it is a good teaching tool for me now.
Absolutely. And one thing that I would probably add to what you're talking is a very similar kind of picture is learned by all of us as the disease tree or upas tree, which absolutely talks what you are speaking. The soil is violation of nature's laws. We have gone away from nature through either ignorance, indifference, or lack of self-control. And that basically is the root for all the lifestyle illnesses that we're talking today. And I'm very happy that you are utilizing all your uh, hobbies as professional tools, and therefore I would urge the viewers, my dear friends and students who are watching this, please develop your hobbies, which will help you both personally as well as professionally.
Yes, definitely. It helps a lot.
So it was wonderful talking to you, Dr. Vinayak, today. Any parting thoughts, if you want to sum up and give a message to our viewers, what it would be?
Me here, and allowing me to interact with these people who are preparing to go in the world out there, and teach people about lifestyle, and natural way of living. What I have understood is that the have great things in them, and uh, there are different stream of thoughts and school of thoughts which inquire about knowledge in different ways, but the knowledge is the same. So if something helps a patient, it is going to help them, whether it is told by a naturopath or like allopathy doctor or a ayurvedic doctor. It is going to help them if it actually helps them. So our we should be we should not limit ourselves to uh, the quarrels of the pathies. Basically, we should have an open mind. We should also have our uh, critical eyes open. We should not take anything if as told by someone. So if you have seen me talking about diabetes reversal, go ahead, go and read those articles. Go ahead, read the ADA guidelines, read the Roy Taylor's research, and think like make opinions for yourself. So always critically think, critically analyze the things. That is very important. And if we are open and if we are critical, we probably are going to get right kind of things for our patients, and that will definitely I think change the healthcare outlook, whatever we see today. And thank you for this opportunity to interact with all these young people. And yeah, it was great to talk to you on this. This is a very uh, favorite topic of mine, and I can speak a lot and lot about diabetes reversal. But yeah, it was a great conversation.
No, I think this is just the beginning, Vinayak, where we start interacting. And like you have wonderfully summed up, it is not whether you are an allopath, whether you are a naturopath, or you are an Ayurveda doctor, or a Siddha, Unani, homeopath, anything. It is what the patient requires. That is where all of us need to stand together and help a fellow human being. And that is a wonderful thought from somebody who is thinking differently. And that is why Dr. Vinayak had been a wonderful guest on our Doctors with a Difference on this Tuesday. I am very much thankful to Dr. Vinayak for his time. And if you have not subscribed to our channel, please do subscribe. Please also visit Dr. Vinayak's channel and look at his blogs and look at what he is doing. If you want to get in touch with him, he's available on Facebook. He has his own page which you can follow. And with that, I think we will come to an end of today's session. Thank you so much for being there, joining from all over the country and abroad as well with us. Thanks for putting out those very active questions and interactions with all of us. I thank Dr. Vinayak once again for his wonderful time with us.
Thank you, Dr. Apar, and thank you, the team. Thank you.
See you on next Tuesday with
Let's
another
keep it.
doctor who is doing things differently.